Hey, thanks for joining us. We're here with Dr. Bilski. Dr. Bilski, it hasn't happened in a while, but I do remember as a kid, I was doing my bike, doing a skid, and my handlebar came right up and they went in my tooth. So for me, that felt like a real emergency. It's during the day, though, so it really wasn't a problem.
Right.
I think of emergencies as like, oh my gosh, something happened, the office is closed. And if that happens and it's after hours, what does one do?
Yeah, the dreaded after-hour toothache.
Yes.
Or trip and fall. I get a lot of emergency calls. I shouldn't say a lot. I usually have 22 to 27-year-old men calling me 2 days after New Year's Eve is what we see.
Those are the ones hold my beer and watch this sort of thing, right?
Yeah. Or they were talking when they should have been listening, perhaps.
Sure.
Someone took action. So anyway, most dentists have at least a phone number that you can call and leave a message, which we do. In our system, though, say it is an after hours or swelling, which is infection, or extreme toothache, bleeding, and then of course the bike accident. Like say it's Saturday night at 9 p.m. and mom says get home, and it's usually at that age between 8 and 10-year-old boy and girl. They flip over the handlebars, crack their front teeth. That's an emergency. Now, even if it's an adult, of course that's an emergency too, because the front tooth, it's visible, and we want to take care of these things quickly. So the best thing to do in our practice is you give us a call, and there is an actual prompt that says if you want to talk to Dr. Bilski or if you want to speak with Dr. Timmerman regarding your emergency, press 1 or press 3 or whatever the number associated with us is, and then that message gets sent to our cell phones. So it's not like in a regular bank voicemail.
Okay, good.
Where my secretary has to...
It's expedited. It's going right there.
You are pushing my extension.
Okay.
So if you want me to speak to you, I listen to it, and I give you a call, and for some reason, I get calls on Sunday morning on my way to church. So I listen to them in the car, and then I either text them back if it's a cell number, or I give them a quick call and say, hey, I'm on my way to church. I'll be done at 9 a.m. How about if we chat at 9:30? Or and they're usually cool with it.
Yeah.
Fortunately for us, in our practice, we have a great patient population, and our emergencies are few and far between, but they do happen. And I think that's a testimony to our staff and how they treat and keep our patients healthy. But then when you do have that accident, the doctors can get to you. So then when we do actually chat with you, we can say things like, hey, have you taken any Advil or any Tylenol? Did you go to the website and click the widget that shows you how to take the regimen for pain relief?
You've got that right on the website.
It's right there. It's actually those animated little, what do they call those? An animation of how to take it. It's like some guy drawing something. It's really neat. I love how you guys did that. But it relaxes everybody, because then there's a step-by-step, very easy thing to follow. And it's amazing, after 1 or 2 of those doses of the Tylenol and the Advil, you feel better. Now, if you have a swelling, it's different. That's infection. We call an antibiotic in. So in most cases, we can't do anything if you're swollen that bad.
Okay.
So again, it's few and far between. I don't want to scare anybody, but if you're having a dental emergency after hours, give us a call or go to our website and see what we have for pain management. And I can assure you that either myself or Dr. Timmerman will give you a call. And if none of us are there, the girls are always monitoring the phones, nighttime, weekends, and someone gets back to you in a reasonable amount of time.
That's good. So in other words, if somebody's watching this video right now on their cell phone, and they're walking and not paying attention, they go right into a pole, and it's midnight.
Not funny, but funny. Yeah.
But I mean, you can give a call.
It certainly can happen.
That's
great.
It
certainly can happen.
So you want to head to bilskidental.com, and that number will be there, and
give us a call, and I will return the call if you hit the prompt for me.